Don't laugh. Thank you for joining me today. I'm pleased to be joined by Secretary Jose Romero. In addition, we have Secretary Solomon Graves that's joined with us today. I first want to emphasize the importance of acting on the latest recommendation of the CDC and the FDA as well, which has recommended a second booster shot for those that are age 50 or more, or those that are immunocompromised. And so for that reason, it might come as a surprise to folks, but I qualify because I'm over 50 years of age, and the First Lady is here with me today, and we're going to get our second booster shot. And the reason we're doing this is that this is the best protection that we can have from serious illness and hospitalizations. And while right now we're in great shape in Arkansas and across the nation in terms of low cases, everybody thinks that COVID is gone, but those that follow this closely understand that it could very well come back this summer or fall as it did last year. And so COVID is not totally in the rearview mirror, and we want to remind people the importance of getting vaccinated, and we encourage you to get vaccinated whether you need the first booster shot or the second booster shot if you qualify for it, or whether you need to start your immunization. We encourage you to do that. And with that, before we take that shot, Dr. Romero, I'll save that till a little bit later, and he might have some additional comments. I did want to mention, and Dr. Romero can reinforce this later, but we recognize natural immunity, and there are those that have had COVID and they have a period of immunity. What is important is that that immunity does not last forever. And so there's a period of time that after you've had COVID that you need to start your immunization to continue the protection down the road. And we encourage you to look at that, and Dr. Romero can later provide more details. With that, we have our great nurses from the Department of Health. Thank you for joining us today, and thank you for your incredible service during this time. Again, thank you to the Department of Health for your assistance today. And next, I want to move to another announcement that comes with some sadness on my part. And we've enjoyed the leadership of Dr. Romero for the last couple of years during the most difficult days of this pandemic. And as has happened before, whenever we have someone of such talent and experience and wisdom, that he's looked at from a national perspective. And so Dr. Romero has kept me informed, but the Center for Disease Control out of Atlanta has offered him a very high-level position that will serve our nation in a similar way that he's served our state. And so Dr. Romero has submitted his resignation in order to take this position. I've accepted it with great gratitude, and that resignation will be effective, I believe it is May 26th. He'll correct me if I'm in error on that. But we're grateful for his service. There hasn't been a better partner that I've had during this pandemic. He's supported me. He's supported our state. He's understood the political dynamics as well as the epidemiology of dealing with this pandemic. And while it's a great loss to Arkansas, he's developed a very, very strong team at the Department of Health that I know will be able to continue with great vigor and continued leadership. But we'll miss Dr. Romero, and I wanted to offer Secretary Romero an opportunity to address the crowd.
Thank you very much, Governor, for those very kind words. And far be it from me to contradict you, sir, but I will be leaving the office on May 6th. I will be leaving the state on the 5th of June. Before I offer some comments about my time here and further gratitude, let me just reinforce what the governor has said about vaccinations and natural immunity. There is no doubt that you have some protection following natural infection with COVID-19, with SARS-CoV-2. What we do know is that that natural immunity, if you choose to use that term, does not persist. And we know that individuals that have been infected and become vaccinated develop higher antibody levels than those that just have the infection itself. So even if you've had, quote, natural infection, end quote, we encourage you to please get vaccinated. And for those of you in the right categories, get your second booster. For those of you who have not completed the primary series, do so, and then follow it through with the boosters. That includes children from 5 to 11, 12 to 18, and of course our seniors that need to have this type of protection. So now let me begin by thanking the governor and thanking you all, but thanking the governor firstly for having allowed me to fill this position, for having placed his trust in me, and for having his ear to advise him, to counsel him in his decisions going forward. Any success that I've had, modicum of success that I've had in this position, is really the result of the work of the governor, the staff at ADH, and any missteps or failures are clearly on my shoulders. You know, I want to thank the chiefs of staff I've had, Chiefs of Staff Stephanie Williams, Chief of Staff Renee Mallory, my comms director, Meg Miraville, the statisticians, our state epidemiologist, Mike Sima, Dr. Dillahay, for their tireless work over this period of time. I could not have provided the information to the governor without their help. I also want to thank Chancellor Cam Patterson for having worked to allow me to maintain my academic position over the last 2 years, and so I thank him. I want to say that we've all talked about the healthcare providers as being heroes. What's not said often enough is that the public health officials are also the heroes of this. They've given up their weekends working continuously, giving up their vacations to sieve, to go through the data necessary to make decisions. And without them, we would have been in a very weak position. All of the staff, all of the personnel at the health department are true heroes. They may not get a lot of press for this, and they don't hang a lot of signs in front of their doors, but they are the heroes. So I want to thank the public, those Arkansans, for allowing me into their homes on a weekly basis to advise them. I want to thank the support, and I want to thank very much the letters and the comments that people sent of encouragement. They helped me during the darkest periods of this pandemic. Lastly, I have to thank my wife, Cosette, who supported me and was my sounding board. Thank you. Thank you. Thank you, sir.
Thank you, Dr. Romero, and grateful to Mrs. Romero as well for her listening to you, and I'm sure you had some things to say during the course of the last couple of years. I want to switch topics completely now to something that's been on my mind and something that has certainly been a challenge for our state and our nation. And our nation has been plagued with a rise in violent crime over the last couple of years. We see it every day. We hear about it on the news. We worry about it in terms of our families. And Arkansas is not exempt from this increase in violent crime. And of course, Little Rock, being the largest metropolitan area of our state, has its unique challenges as well. And while this is an issue that has to be addressed by local authorities, I know that the state has some steps that we can take as well, and I want to take those steps today. And so today I'm announcing an expansion of the intensive supervision program, which is a part of our Division of Community Corrections of the Department of Corrections. These are those that have spent time in prison, that are released on parole, that are trying to get a second start in life, and we want to be able to help them to do that. But you also have an element of those that pose a greater risk than others. And so that is the design of the intensive supervision program that focuses on high-risk offenders who are on parole but have a history of violence or gang affiliation. This program is currently in existence and is comprised of 4 officers in Pulaski County. We want to add an additional 10 intensive supervision officers to that program that will cover 5 counties, including Lonoke, Jefferson, Faulkner, Saline, and Pulaski. And you might ask yourself as to whether that is enough. Please understand that we have an additional 70 parole officers just here in Pulaski County that's doing routine parole services. What this program is, intensive supervision, is to provide a higher level of support, of scrutiny, of supervision of those that pose a higher risk, that have a history of violence. We believe this will make a difference, and we want to increase that supervision. This will cost, in the first year to start, $1,091,000. I will be providing that funding with the support of the General Assembly, and then it will have ongoing costs each year of $820,000. And that will, of course, require the support of the General Assembly. We have some legislators here, which I appreciate you being here today, and this will take multiple steps to have approval through the General Assembly, from assignment of the positions to the approval of the funding for these. But we know that they share the concern about violent crime in Arkansas, and that I'm hopeful that they will be supportive of this. This will make a difference, because what intensive supervision means is that the individual that's on parole is going to have more support, but also more checking in. We're going to find some violators, and if those violations involve guns, then their parole will be revoked and they will go back to prison. That is the design of this, and that is a critical element of it. Now, let me address one more issue that is something that I can't control because it's up to prosecutors and judges. And whenever I see the shooting in Dumas, I first check to see whether this is somebody that's been on parole. That is a worry to me that maybe they shouldn't have been released or they slipped through the system. In Dumas, that was not the case. In Dumas, these are first-time felony offenders. And so that's not something that would have been stopped by this intensive supervision. But there's other instances in which somebody is released on parole that the intensive supervision will make a difference. But whenever you're looking at sometimes first-time offenders in a violent crime, the next question is, are they held in custody pending trial? Do they pose a continued risk to our community, or are they released? And these are decisions that are made by judges. They're decisions made by prosecutors. And in reference to Dumas, I've put in a call to the prosecutor. I'd like to hear more about what happened there. But in the shooting in Dumas, one of the alleged perpetrators was released on a $100,000 bond. Now, I don't understand that, quite frankly. When you're looking at that type of violence, that type of activity, and that this compels, in my judgment, someone to be held in custody if they pose a continued risk. And so I want to learn more about that, but we have to make sure we coordinate with our prosecutors and judges. And I'm going to be meeting with some of the prosecutors and having discussions with them. And I know that in times past they said, well, we don't have enough room in our county jails because they're backed up, and so we can't revoke a probation or we can't hold them pending trial, even though it might be a violent offense. Well, Secretary Graves is here, and I've charged him with, let's relieve that burden. Let's make sure our county jails have space. Let's make sure we move those that are assigned to state custody into the prison system. And so today, I understand from Secretary Graves that in Pulaski County there are no state prisoners backed up. Now that varies day to day, but we are moving them out into state custody so that we can have room in our county facilities in the event the prosecutor and the judge recommends no bail or they're a violent offender and they need to be kept into custody. We want to keep our streets safe. The intensive supervision will help us in that regard, but we also need to look at who is released and under the conditions when they're released while pending trial, because those have historically posed some risk to us as well. With that, let me invite Secretary Graves if he wants to follow up the comment.
I want to thank the governor for his support of our request to expand our intensive supervision program. Effective community correctional programming requires two things. First is evidence-based rehabilitative programming, which we are committed to and which we will continue to be committed to. But that effective supervision of offenders on parole and probation also requires that the state has adequate resources to provide for strict compliance with conditions of supervision. And there is a segment of our parole and probation population that is high risk, that have demonstrated a history of violence, that have demonstrated a history of gang affiliation. They need a little closer level of contact by our officers. And this ISP program will do that, not just in Pulaski County, but what we are excited about within our Division of Community Correction is this will allow Director Bradshaw and his team to really address the spillover into those communities that border our largest metropolitan area. So again, Governor, thank you for your continued support.
With that, we'll take any questions.
This might be a question for Secretary Graves, but with this unit that's going to have additional members, that means more people might be caught, end up going back to prison system. Also, combining that with trying to clear out the county jails, I guess the question is, does our prison system have enough space to make this possible?
Well, let me first answer it, then I'll turn it over to Secretary Graves, but that is exactly the reason that Secretary Graves and the Board of Corrections has asked for additional prison space. And the General Assembly supported that request. We have allocated, I believe it's $75 million for a new facility that will house close to 500 new beds. And so we're looking to the future, and while we're making the adjustments that are needed now, we know that that population can grow, and we're making accommodations for that.
Just to clarify something, so if one of these, intensive supervision officers finds that one of the or someone on parole, that their crime involved guns, you said that that would then cause them to revoke parole, is that correct?
Yeah, but let me rephrase that. So if you are convicted as a felon, and you're out on parole, one of the conditions of your parole is that you do not possess firearms. That's illegal. And so as the intensive supervision program will go in and do an inspection of the parolee's vehicle or their person or their residence, and they find a firearm, then that is a violation of the law. They would have to go before an administrative law judge who would make a determination, and if that is the case, then they would go back to prison. Their parole would be revoked.
And if this gets approved, when would it go into effect? When would these new officers be added?
Immediately. Now, of course, we need to have legislative approval, but as soon as Secretary Graves and Director can hire the individuals, then it will be in place.
And do other counties have this program already? I know there were 4 in Pulaski, but do any exist in other counties?
I'm going to ask, the answer is no, but go ahead, Secretary Graves.
The intensive supervision program is currently unique to what we call Area 8, which is our Pulaski County catchment area. Statewide, we have a team called the Special Response Team within the Division of Community Correction. They work to, in all of our 12 supervision areas, to partner with local law enforcement and bring parole violators back into custody. But we have this additional resource within Pulaski County.
In terms of COVID issues, there was a program that had paid for testing, treatment, and vaccines for people with no insurance, and because of lack of funding, that's going away. And apparently even the bipartisan deal in the Senate does not include funding for that program. Are you concerned about that program going away, and do you think that Congress should allocate money for that?
Well, at the present time, and everybody needs to understand that if they want a vaccine, even if they don't have insurance, they can go to our public health office and they can get the vaccine, they can get tested at no charge. Now, at some point down the road, we may run out of that capacity to do that, but at the present time we do, and you can go to the public health office to do that. In terms of the bill that's being worked on, the $10 billion compromise, we'll have to look at that more closely. I yield to you, Andy, but my belief is that that is for vaccine, that will provide funding for a new round of vaccines that will help us, particularly with this new demand of a second booster shot.
Some medical experts I've spoken to are still worried that even though we have low cases right now, we're relaxing guidance too soon, kind of deja vu to maybe last summer, and that we still have relatively low initial vaccination rates. Is that something you're concerned about?
I always want to increase the vaccination rate, and that is the answer, is for the population to get vaccinated even during this lull in COVID. In terms of, and I disagree with Dr. Fauci. I think that is the wrong message to say we're going to have a new round of restrictions down the road. We need to concentrate on the vaccinations versus other outcomes. The public should understand that, and I think we don't need to have and retrace the steps that were taken in the past when we didn't have a vaccine, which was more restrictions.
Is this intensive supervision possible next week?
I will have to wait and see as to whether it can get there that quickly. They'd have to suspend the rules. If we can, I would love to. From my standpoint, I'm signing off on it. I'm putting it in the legislature, and as soon as they can consider it, this would be terrific.
Where's the money coming from?
It'll come from discretionary funds, either the restricted reserve or rainy day funds.
This might be another question for Secretary Graves, but with the additional officers, do you know how many parole officers will have 2 parolees, the number-wise?
Stephen, on a statewide basis, we're at about 80 offenders to officer. This ISP program, it functions off of a smaller officer to offender ratio. Our current team has about a 40-to-1 ratio, and we're looking to probably keep it in that same level as we expand in Pulaski County into the surrounding communities.
Is there anyone participating remotely that would like to ask a question?
Yeah,
Governor,
hey,
this is
Governor,
Andrew
with 5 News, the senior station of Northwest Arkansas. Tomorrow marks a week since a near-free tornado tore through Springdale. It's been speaking with people throughout the week about how they feel. Some adjective they use to describe is angry, frustrated, upset, and discussed that they have installed that many state elected officials in the area toward the damage. So I was saying, any thoughts on that, and if you would be touring the damage?
Well, of course, I grew up in Springdale, and so I care a lot about the Springdale community. I've spoken with the mayor. I've talked to others there as well about the recovery efforts and how we can be of assistance. Director Gary, my director of ADAM, is available as well as the local emergency management officials. And so as needed, I will be there in the community, and my heart goes out to the community, and grateful for all the volunteers that have come to the assistance and provided help. Next question.
Governor, it's Mitch at Channel 4. With the intensive supervision, that could still be several months out, if not longer. Is there anything that the state could do now, in the meantime, to reduce violent crime in cities like Little Rock and Pine Bluff? And then my second question, just based off your social media, recent social media posts, there's a lot that one would think that you're running for president. Is it safe to say that you're considering a run for president?
Well, let me first answer the question as to is there anything that can be done now. We're doing it every day in our routine responsibilities and accelerating our engagement, our support of local law enforcement. Ultimately, this is a responsibility of our city officials and our city law enforcement. That's the way it's always been. The state supports them. Of course, we have responsibility with parolees. And so it's a partnership, and we will do anything that we can as urgently as we can, because, as I said, it's not just a local problem, it's a national problem, but this has been on my mind. In reference to the second part of the question, as you can see, I'm fully focused on being governor. That's my responsibility. And I am concerned about our national direction, what's happening globally with our country and with my party. And so, as I have opportunity to provide and influence the direction of our country, I want to do that because I care. But my focus right now is right here in Arkansas. Any other questions?
So you are considering one?
I'm not considering it. I would say that option is open down the road because it's a long ways down the road.
Governor, this is Andrew with AP. Had two questions. First, for you, you had put out a statement yesterday about the surplus where you had seemed to float the possibility of there being some additional relief for taxpayers because of gas prices and inflation. I wanted to see if you could elaborate a little bit more on what specific proposals are you looking at, and how seriously are you looking at a special session to take up something like that? And secondly, I had a question for Dr. Romero. Just wanted to ask him, if his decision to leave for the job with CDC, if that was influenced at all by some of the pushback that he and your administration had faced from some lawmakers during the pandemic, if that had any impact.
Andrew, first in reference to the surplus, we had a great report from our revenue monthly statements that showed that we continued to run a surplus. My comment really goes back to the fact that I know that Arkansans are struggling with higher fuel costs. We drive a long ways to work, working in the factory or working on the farm, so it really adds to our costs, and it's a concern. We have other inflationary pressures, and I know that our families are feeling that. I don't think the solution is to suspend a gas tax, because that's a temporary fix. And it also jeopardizes our investment in something that's very important for our citizens, which is roads that don't tear up your car every day. And so that's why whenever you're running a surplus, I think you have to look at giving that part of that back to the taxpayers. That's a legislative decision. There's not any special session that's planned in the near future, but it is an option that should be considered down the road. All right, with that, thank you very much today. Y'all have a good afternoon.